Despite being diagnosed with arthritis of the knee, when you have heard awful phrases used to describe your x-rays like bone spurs, degeneration, wearing away, those phrases scare you, I get that, and there is nothing to worry when Ayurveda is at your rescue. India is expected to be the chronic disease capital with an estimate of 60 million people with arthritis by the end of 2025. Currently, in OA affected persons, 80% have movement limitations while the remaining 20% of the people are unable to perform their day-to-day activities. It has been postulated that age, gender, repetitive trauma, weight gain and genetic factors play a very important role in the manifestation of this illness. And we are going to change the narrative of osteoarthritis of the knee by strengthening the knee joints with Ayurveda. Hello everyone and welcome to my YouTube channel. I am Dr. Smriti Walson, and in today's video I am going to talk about osteoarthritis and how it can be treated and managed in Ayurveda. But before we get into it, for those of you all who are new here, do watch my previous videos, and if you did like them, then please don't forget to hit that subscribe button along with the bell icon right next to it so that you get updated with all the latest Ayurvedic remedies and lifestyle content here on my YouTube channel. And without further ado, let's get into this. Osteoarthritis is also known as degenerative joint disease or degenerative arthritis, and it is the most common chronic joint condition worldwide. It occurs when the protective cartilage which cushions the end of your bones wears down over time. Although osteoarthritis can damage any joint, the disorder most commonly affects the joints in your hands, knees, hips and spine. A joint is where two bones come together and the ends of the bones is covered by a protective tissue called cartilage. Cartilage is a tough, rubbery substance that's flexible and softer than a bone. Its job is to protect the ends of the bones within the joint and allow them to move easily against each other, which leads to smooth movements of the joints and also helps the joints in bearing their own body weight. Now with osteoarthritis, these cartilages breaks down and the bone surface becomes pitted and rough, and it causes pain and irritation of the surrounding tissues. Damaged cartilage can't repair itself. This is because cartilage doesn't contain any blood vessel. Cartilage wears away completely and the cushioning buffer that it provides decreases, leading to the bone-to-bone contact, which thereby leads to pain, stiffness, tenderness and inflammation. It occurs most commonly in older population, although it can occur in any age, and it is a leading cause of disability and affects more than 30 million men and women in the United States alone. Coming to the sites of osteoarthritis, now this can occur in any joint. However, the most common sites are the small joints of the hands, fingertips, knees, hips and spine, typically at the neck or lower back. The most common cause is long-term joint damage, which is the most common reason for affecting the older population. With age, our joints get damaged due to various reasons. This damage accumulates over time. The older you are, the more wear and tear occurs at your joints. Direct joint damage can also lead to osteoarthritis. This includes fractures, dislocation, torn cartilages and ligament injuries. There are many other causes such as joint malformations, obesity, then poor posture, family history, and also females are at a higher risk. Coming to the symptoms of osteoarthritis, this includes pain in the joints, which is more severe after movements and fatigue of the joints, and pain increases in the morning with tenderness, stiffness, inflammation, redness, and swelling. Other symptoms includes muscle weakness, bone spurs, and joint deformities. With that, I have given you a brief description about the concept of osteoarthritis, and now we'll be getting on to how it is treated in Ayurveda. Panchakarma plays a very important role in the management or treatment of osteoarthritis. Not only that, the treatment protocol varies depending upon the chronicity of the ailment. The duration also varies for a period of 7 to 14 days based on the condition of the patient. There are different therapies mentioned in the classical texts of Ayurveda to take care of pain in the knee joints. Few of the treatments are Abhyangam, Swedana, Lepa, Janubasti, Virechana and Basti. Now the therapy which is utilized to treat such conditions depends upon the chronicity as well as the condition of the patient. So one of the major therapies mentioned in Ayurveda in treating knee joint pain is a therapy called as Janubasti. This is one of the external therapies mentioned in Ayurveda, and I thought of broadcasting this to all of you out there with an intention to prevent the progression of this disease and also to incorporate Ayurveda in one's lifestyle. So before doing Janubasti, I'll be making the patient undergo Sthanika Abhyangam, that is massage associated with hot fermentation, that is called as Swedana. So this is a localized treatment. So as you can see, first we start with Sthanika Abhyangam, that is localized massage, which will be mild. And after this is done, then we do the Khiri treatment. So what we do is, as you have seen the herbs, we fry it and then we put it in a cloth, we make it in the form of a potili and hot fermentation is done. This is just done to improve the blood circulation, and after this Janubasti therapy is done. So to do this treatment, first I'll be taking a bolus of black gram powder, and this is taken and made into the form of a well, and this is placed over the knee joint. So this has to be done with utmost precision to avoid leakage of the medicine, after which oil is taken, heated, and it is poured and retained over the joints. Knee replacement surgery is one of the latest developments in medical science. Now, whether it is good or bad, the decision has to be taken considering the individual's case. For example, if there is a 75-year-old weak patient with a cardiac problem who has high risks of undergoing a surgery and who has intermittent attacks of pain which is on and off, so for such kind of cases, the first line of treatment can definitely be Ayurveda because it can give instant relief. Now Ayurvedic therapies help heal the knee joint, and also with that one can avoid knee replacement surgeries. When pain and swelling caused by osteoarthritis are chronic, then the best option for you is to enlist the expertise of an Ayurvedic doctor. An in-depth examination will give a fresh look at your condition and also provide and plan the right treatment protocol. Osteoarthritis worsens over time, and Ayurveda offers the best holistic approach to treatment which will help prevent the progress of the disease and also improve the mobility and function of the joints. With that, we have come to an end with this video. If you guys like my video, then please don't forget to like, share and subscribe, and I'm going to see you guys very soon in my next video. Till then, stay tuned and thanks for watching.